Despite no new reported measles cases in Indiana in the last few months, the CDC is still warning the threat is not over. Cases continue to climb in the U.S. and around the world. I talked to local experts about protecting your health as we head into a busy summer travel season. Indiana is reeling off record Memorial Day travel at the Indianapolis International Airport. And as summer takes off, health officials are sharing an important message.
With everyone traveling into areas where there are higher rates of measles, we'll need to keep an eye on it and see if there's further cases in Indiana.
All 8 measles cases in Indiana were in Allen County, but there have been no new cases reported since April. However, the CDC reported more than 40 cases in the U.S. this week, bringing the total to over 1,000 nationwide.
Where the spread of measles happens is it happens because of travelers, and the measles virus itself can live for 2 hours outside of the body. If you had a room of 10 people that were unvaccinated, 9 of them are going to probably pick up the virus.
Local health officials say it's crucial to take precautions ahead of any domestic or international travel this summer.
I would recommend getting the vaccine before you travel. Both vaccines of the series, then you have 97% chance of not getting measles if you're exposed.
Local health officials say measles isn't the only concern this summer.
We're starting to see parainfluenza virus and adenovirus, and also Coxsackie virus that causes what people call hand, foot, and mouth disease.
That's why it's important to always follow good practices no matter what you're doing this summer, which means washing your hands, it also means covering your cough, staying home when you don't feel well, and of course, rolling up your sleeve whenever you can.
If those vaccines are in place, we'll have decreased infections here in Indiana.
Dr. Reynoso says it's also important for travelers to be mindful that kids under the age of 1 cannot get the measles vaccine yet, so they won't have that protection if you're going into areas with higher rates. They also recommend checking with your doctor to see if you or your child are up to date on shots.